Hello, I'm Dr. Jeffrey Nisgoda, and welcome back to AZH Wound Centers in Milwaukee, Wisconsin, for another edition of the Wound Care Window. I've been telling you over the last several weeks that wound care specialists need not only to be able to focus on the wound, but also be able to perform other evaluations, perform other procedures, and this is a good example. I have a patient that presented today. She came in for her stasis dermatitis for venous hypertension insufficiency. She's had a prior ulcer here. And we're going to be taking care of this as well for her. However, on my examination, I noticed that she had some tape here on her toes, and I noticed that her toenails were in need of some care. This young lady tells me that she's got a little difficulty getting to her toenails and hasn't been in to see a podiatrist. Clearly, our friends in the podiatric community would be very easily able to manage and take care of this. However, at this point, I'm a little concerned because you can see these nails have curled over and they're actually embedding in the dorsal aspect of her digit here. This is a setup for a disaster. This nail could continue to grow, actually cause an ulceration and an infection, and result in a severe infection, maybe even an amputation. So we want to take care of these nails here today. And then get her into the hands of a podiatrist for continued maintenance care. So let's see what's underneath this piece of tape here. And we see some more nail irregular. Now this one is not as severe, obviously, but you can see how these have completely grown in such a fashion that they're curving back. And this one here is actually starting to embed itself into the dorsal aspect of the toe, you see there. So we're going to go ahead and take these down, and I wanted to show you a trick that might be helpful to you when you see a patient like this. So the first concern is, how do we get rid of that nail? Certainly nail clippers would be reasonable. However, I'm very concerned about putting a nail clipper in there and removing this nail. So I wanted to show you another technique that works very, very nicely, and that's the use of a Dremel tool. The Dremel allows controlled debridement of this area. And what I'm going to do is I'm going to use the Dremel as sort of a saw. I'm going to take the proximal base of the nail down like this. This Dremel has a suction device on it, so a lot of the nail is being sucked into the device rather than being aerosolized. You see I'm cutting right across the nail base. And there it goes. So here's the nail. It's been removed. This was sitting here like this. We took this part down with the Dremel, and we were able to remove that nail in its entirety. What you can then do is come back with your Dremel, take down any parts of the nail that are sharp. Again, we're not going to do a manicure here, but we've actually prevented this patient from having an ulceration happen on the dorsum of the toe. As you see there, it's starting to grow in. We'll demonstrate that again with this other digit. Most classically, we use the Dremel for taking callus down, but I found it very helpful as part of the care of these patients. And again, you see it comes off very nicely. See the early indentation, pre-ulcer formation there. We'll go ahead and manicure that nail a little bit. And we prevented her from having an ulcer form. So I hope you've enjoyed this edition of the Wound Care Window, an insight into the interesting world of wound care, and the fact that as wound care specialists we need to be versatile in our care of these patients. We're not just looking at the wound. There are other aspects for not only care as well as prevention of wounds. Thanks for joining us.